Hey Thomas, how's it going?
Going good. How are you?
Doing very well. Appreciate you agreeing to jump on.
No, thank you.
Um,
Yeah, I welcome any opportunity I can to, talk about what we do.
yeah, Thomas, so just to kick things off, I mean, at a high level, who do you help and how do you help them?
So we help children with special medical needs. We not only help the child, but we help the families as well. We take care of them throughout the day with skilled nurses and therapists. We provide transportation to and from the facility. So when they come to us, they get all the skilled nursing care they need and therapies under one roof.
I love that. I'm a little really ignorant to this industry. I didn't know this was an industry that really even existed. I mean, like I guess what would make someone need a facility such as tender care?
So a lot of times it's a child that has, either medical needs that are not going to be able to be met at the school system or in a regular daycare, or we are opposed to like a home health or a private duty nurse. We give the child a chance to come interact and socialize while getting that medical care they need, as well as, the family, or typically it's the mother or the caregiver, an opportunity to go back to work or school and have a place she can trust that takes care of her child.
Gosh, yeah, I guess I just never realized kind of what people with, kids with medical issues, I mean, what they did. Mom, dad
Yeah.
works. I mean, a typical daycare just isn't equipped to handle that from the sounds of it.
Yeah, so typically, what happens is a regular daycare is not going to be able to accommodate them. So then they'll look at home health nursing. Home health nursing is great; they get it in their home, but then you're bringing someone else into your home, and as well as that, it kind of isolates the child. So we give them a chance to,
Mm,
socialize and get all the services, and then as well as that, now they're tapped into a bunch of other resources and a bunch of other things that can start making, a difference for the child. We've had some success stories where a child has came from us straight from the NICU. Like they might have spent a couple months in the NICU when they were born, and then came to us, and we were able to help bring them to that next level where we've transitioned them either to a regular daycare where they don't qualify for our services anymore, or transition to school. We also like to bring in an educational portion to it, so it's not just about the nursing care, it's about the child, benefiting the child in a whole.
wow, that's quite a service you guys provide. Have you found that, 'cause you brought up a good point with the home health care, have you found that kid being isolated or having that socialization, has that been really critical to their overall development and care?
Personally, I think so. I think it makes a big difference when they're able to be around peers, or others that, you know just sometimes being around other people and interactions with other people, even de- depending on the level or the developmental level of the child, they start picking up on cues and they start learning ways to communicate, even if it's not talking. They're able to now communicate with others based on picking up, things from other people.
Mm,
Another
yeah.
thing we offer, opposed to the home health nursing, is consistency. I like to say we don't call out. We're not going to no show on you. It tends to be when you're in the home health, you rely on one, maybe two nurses to show up every day. If they're sick or if they have an issue, they might not be able to make it that day. Where we're full facility staffed, where we're not. If one person calls out, it doesn't make or break our day.
Yeah, that's a great point. Do you find that being no-showed or just dealing with, individual caregivers, that's a pretty big problem in the home healthcare space? People are not showing up, plans changing. Is that pretty common?
It seems to be pretty common, and especially now, uh, kind of in a nursing shortage. So, finding quality nurses that are consistent can be a problem. And,
Mm,
there's where we offer a 3-to-1 ratio and home health is a 1-to-1 ratio. It's a little different, but you're still getting that level of care because every child has an individual care plan that we follow. It's all tailored to that child, and we're able to make sure that we're hitting those daily goals of what needs to be done and the daily interventions, and still have other children there as well.
So it's a 3-to-1 ratio versus a 1-to-1.
Yeah. Yeah. So we, for every three children, we have one staff member, and it alternates between an RN, a CNA, and an LPN.
For every 3 children, you have 1 staff member, or is it the reverse?
So every three children, we have one staff member.
Okay,
So
gotcha.
yeah, yeah.
Gotcha. Okay. I was looking at your website, and it looks like you guys do a lot of different things, from activities, things for the kids to do, education, plus of course the healthcare component to it.
Yeah, we like to, the healthcare part is like the main thing, but we want to be able to provide more than just the healthcare. We want to affect the overall well-being of the child. So when we're able to encompass the therapies and then also the education as well as activities, we really pride ourselves on making sure that the child's not just sitting there all day or in a seat. We're the interaction. It's amazing. I've seen it firsthand what our facilities can do. When you're able to see a child walk that they said might not walk, or a child that's had a feeding tube start eating by mouth,
Oh,
uh,
really?
even children that they said might not communicate, but then start using a communication device. They start using an iPad to communicate. Those things are just incredible, and it's a feeling that you had a small part in this child's development to better their future.
So we're not just talking about management; we're talking about rehabilitation in some cases.
Yeah, yeah, every child's different, but sometimes, with the intensive therapies that they can get, because some of our kids that attend get therapy 3 times a week, and it's three different types of therapy between speech, occupational, and physical therapy. They're getting that 3 times a week, where getting that consistent ability to interact and work on these goals, you see a difference in 6 months that you might not get by just taking them once a week to a therapy session, in an outpatient setting.
Mm, that's amazing. What do you think the reason is for that? That they might be developing, faster or better than they would otherwise?
But I think it goes to the frequency that we're able to do the therapies, as well as again, that social aspect. They're in rooms with other kids that are either walking or talking and moving around doing these different things, or they're in the lunchroom with the kids eating and they're seeing them eating by mouth. They want to eat by mouth, and slowly, like, the therapists work on these different goals with them, and they're able to then mimic and also you know have the therapy alongside seeing these other kids. So it's not in a one-on-one setting in a room. They can do the therapies in the rooms with the kids where there's other kids interacting, and they can help them achieve these goals.
That's incredible. And I would imagine that going through these health challenges, it can be devastating to everybody involved, the parents, the kids, everybody. But being in a community like that, I imagine is only going to be helpful, right? To see that you're not on an island. You have other people that are
Yeah.
going through what you're going through.
Yeah, I like to say that we're part of the family's village. And we're
Mhm.
building a village of people that, eh, if we can't help them, we try to put them in touch with people who can. And everybody from our our drivers that drive the kids to the front office staff to the kitchen staff, everybody builds a bond with these kids, and they become part of that village for the child and the family. The drivers come in early so they can interact with the children, and sometimes they bring them gifts, or the kitchen aides, they make special lunches or different, for birthdays. Everybody really becomes part of that child's life.
Yeah. I like that phrase, the child's village, right? Because that saying, "It takes a village to raise a kid." Really, our society doesn't really follow that anymore. we're all like these little individualized, cell groups. It's not the way that most humans have lived for thousands of years in, what was small villages, right? And
right?
I think about that a lot, about how it's very unnatural to live how we are now. And if they are in, communities, it's like giant schools. We're not talking about small villages anymore. It's like giant schools, thousands of people, almost like an overpopulation issue, or small separated families, not like true villages of how we probably, spent most of our time.
Yeah, I'd say it probably has a lot to do with technology. We've become isolated. We isolate our families, we isolate ourselves, and because the way we're communicating right now, it makes it so much easier and convenient for people. They forget about that the actual human aspect of everything and the human touch and how things like that can benefit.
Yeah. Yeah. I know you guys help with a wide array of different medical issues, and it's too many to name, but I mean, just briefly, I mean, are there any issues that I guess would be out of scope for you guys?
So we like deal from everything from you know children on ventilators to feeding tubes, seizures.
Oh, wow.
Unfortunately, we're funded by Medicaid, so all of our services the parent doesn't pay for, but it's funded through Medicaid. Autism alone doesn't qualify for our services, so we get a lot of calls for autism, and it's really hard to turn someone away, knowing that our
Mm.
services could help that child as well. So what we like to do is build relationships with autism schools or other organizations that help children with autism.
Got it. Very interesting. A few things I want to unpack there. The Medicaid thing. So the parents aren't paying for this. This is a governmental program from the
Mm-hmm.
sounds of it. That's huge because I was thinking, okay, this must be really expensive for the families, but doesn't sound like it. That's great.
Yeah, the one thing I'd like to work on with that is the access to care for families that are not that they don't meet that Medicaid threshold, and private insurances really don't recognize what we do or want to recognize what we do. So you know the ability for a family, it becomes hard for them. They make the choice of providing for their family or getting this care for their child. So one of the things I'd like to work on in the future is access to our care for any individual that would qualify.
Mm, yeah. So what does a family do if they want your services, but they just don't qualify?
So there's different things. Some of the new Florida Healthy Kids plans will cover our services,
Okay.
like Simply Healthcare. We've had some single case agreements with them where they will pay for our services. So what we always try to do is work with the family, and if they have a private insurance, see if they're willing to switch and pay for the Florida Healthy Kids, which is the subsidized program through the state, and then work with that insurance provider to get approval for services.
Mm, great. Okay, good. And then why do you feel like autism is not a good situation for you guys to handle? Like what makes that unique?
So, based on what we do, it's supposed to be skilled nursing needs, and autism doesn't require a skilled nursing need. So that's where that Medicaid portion, you know, they don't recognize that as a nursing need, while the low care ratios, all the therapies and everything involved benefits a child with autism at an early age and can get those early interventions. Um, Unfortunately, it's not our scope from the Medicaid or the Department of Health or ACA in Florida.
Yep. Are there facilities like yours specifically for autism, or is that not a
So
thing yet?
so that is kind of a thing. There's more and more. We've tried to build some relationships in different areas with schools like that, where they provide the ABA therapy and they have low ratios and they cater to the autism diagnosis.
Gotcha. Gotcha. Okay. And you guys are, I know we chatted about this briefly. You're all over the state of Florida. You're in some other states as well, right?
So we are currently we have 6 locations in Florida. We're currently working on a project in Texas. In Florida, there's 178 PPECs, like similar to what we do. In Texas, there's currently 10. They just recently, well, I say recently, it's probably been 5 years since they really adopted the same type of regulations as Florida. And
Mm.
we went in there thinking that we could have a building very similar to what we are accustomed to here in Florida, but their building requirements are a lot more. So that's caused some delays in our process.
Yeah, lots of weather issues in Florida and in Texas too.
Yeah, yeah, and they treat in Texas they treat it almost like a inpatient hospital rather than a day facility. So there's a lot more life safety features that they require in Texas, which we're learning out.
And what was the rationale of Florida and Texas? Is it just any thought behind that, or is this just kind of the states you like?
Well, currently in the United States, I believe there's only 16 states that have these PPEC, or it's prescribed pediatric extended care uh, regulations within their government, and Texas was the newest one that adopted these. So that's why we thought we could go there and make a difference for these families. And um, we're still trying, but it's becoming a little harder than we anticipated. You know,
Yeah.
so that was it made sense. Currently we have centers in Fort Lauderdale, West Palm Beach, Spring Hill, Dunellen, which is like right outside of Ocala, Palatka, and St. Augustine. So we're pretty spread out throughout the state, and our centers are kind of in twos where the two centers help each other. So like Fort Lauderdale and West Palm, they kind of share employees and staff when needed, and the same thing with the other centers. But we thought, well, let's try this in another state and see what we can do.
Yeah. And do you find that people find you pretty easily? Like, is this a very pain aware, demographic, or do people just not know enough about you to look for you?
So it depends on the area. Typically in an area like Spring Hill, it's not as well known. So it
Mm.
takes more education on the services and what we do and can provide. Uh, in South Florida, there's a lot more facilities. In Dade County, I believe there's 50 facilities. In Broward County, I want to say like 30, and 20 something in Palm Beach County. So, there it's more about letting them know, you know, it's not just a number to us. It's actually about making a difference in their lives.
Yeah. Yeah. I wonder, and you may have already done this research, but I'm wondering if there's any states that like have more of a need than others, or is it pretty evenly distributed across the US? Any idea about that?
So it's more of the populated states where they have the higher need, and we've found this a niche in more of the suburbs. That's where our best centers are performing, and it's based on just that's educating the community about our services. But typically, you'll see in the bigger cities more of a need. It goes along with the Medicaid rates and the poverty rates within the city.
Mm, yeah, that makes sense. Any plans to expand across the US and take over? Or are you just gonna hang out in Florida and Texas for a while?
If it was up to me, we would go to every state. I've personally, like I said, seen the difference at what we do and how it helps families, and we have uh, we have some plans. We've thought about Pennsylvania because they only have a few. There's I've been talking to someone who's trying to get the legislation passed in Virginia.
Mm,
So that's another possibility. You know, anything's on the table as far as that. If uh, we're trying to build our team at Tender Care. So here's a little bit about us. My wife's grandfather started the business 36 years ago, and
oh wow.
yeah, we were the first independently owned PPEC in the state of Florida. We started along with another company that um, he got involved with, and then decided to they opened one in the Tampa area, and he said, "Well, I'm going to go open one in South Florida if you guys are okay with that." So Fort Lauderdale was our first center, and over the years, as the family's grown, it's kind of slowly grew, and now the younger generation is coming in and taking the realms of the or like the reins of the company, and we see the impact we have on the communities we serve, and we'd love to bring that to more communities.
So, wife's dad started the business a long time ago. At what point did you get involved?
So 13 years ago, I had another business, and I started on the side driving part-time for the business, and started as a part-time driver. It worked out perfect. I could drive early morning, take care of what I needed during the day, and then go back in the afternoon. Uh, then they decided, well, we're going to be opening a new facility. We'd love for you to, go and help establish it. So I was able to start from the ground up our Dunellen facility, and had some success there as far as you know bringing in patients and serving in the community. Got involved with a lot of different community events and initiatives. I still currently serve on the board of the Early Learning Coalition of Marion County in the area, and went from being the assistant administrator of that facility then to more of the corporate role. Currently, I'm vice president, but it all started as just being a part-time driver and really falling in love with the kids.
Is that what kind of made you switch from, having your own business to going more in the community service or nonprofit sector?
Yeah, so we are a for-profit, but we're funded by Medicaid, so our margins aren't very large. But
Yeah.
um, yeah, it was the opportunity came, and I was like, I really love what Tender Care does and the difference we make. So um, I say it was a hard decision, but it really my heart took me to this. Yeah,
Seems like it's more fulfilling for you. Like you're not doing this for dollars. That's obvious.
yeah, yeah. It's definitely um, I can I can end every day knowing that we're making a difference, and I truly love that. I When I was in Dunellen, we had twin girls that had just came from the NICU, and they were being removed from their home, didn't have placement. I messaged my wife and said, "Do you want twins for the night?" And twins for the night has turned into this past July 9th was 4 years. We have permanent guardianship. They don't qualify for services anymore at our facilities. They've graduated from all the therapies and our services. They're getting ready to go to a VPK program, and you know being able to see when we got them, we thought they might have delays and different issues, swallowing issues, and seeing them slowly get past all those things was amazing. And my my daughter Michaela, she just got diagnosed with cerebral palsy, but
Mm.
very very mild case, and it solidified the reason we were brought into their lives, because we have the resources to make sure she's getting the right care.
Wow, that's incredible.
Yeah, yeah,
And what and again, I'm just kind of ignorant to this whole industry,
yeah.
the stuff that happens, but I mean, what reason were they being removed from their home originally that, you guys came in the first place?
Um, DCF was involved.
Oh, okay.
They were born 29 weeks, and you know very very premature, and there was a lot of other issues. They
Gotcha.
were being followed by DCF at the time, so there was a lot going on with that. And we do get a lot of cases, that DCF is involved because of multitude of reasons, but
Yeah.
we
Yeah.
offer a safe place for the children. And a lot of times a child that is born premature or has an extended NICU stay, they're they automatically qualified for 6 months for observation to make sure that medically everything is going okay with them. Once they're released from the NICU, we're like a transition almost for those children.
Yeah. Yeah. Got it. That makes sense. I've often thought that, I'm in sales and marketing, and I often thought, hey, if I ever got into any other industry, it would have to be something in the nonprofit or community service, sector, something in that world that's like
Yeah.
fulfillment. Because I just, I can't imagine anything, more fulfilling than doing that. I've even tossed around the idea of like foster care. My wife and I have talked about that a bit. It's so challenging, but it seems like it'd be really rewarding.
Yeah, it definitely, it's definitely challenging, but the reward at the end of the day outweighs the challenges, I would say.
I'm going to ask you in just a minute for some of your favorite stories or
Yeah.
testimonials, because I
Yeah.
want to end on a high note. But before we get to that, I want to talk a little bit about marketing. I
Yeah.
think I found you. Correct me if I'm wrong. I found you in the Apex group, right? Ryan Stewman
Yes.
Mastermind.
Yes.
Yeah, yeah. I love that group. Learned a
Oh,
lot of
it's great.
cool stuff from them. What's your experience been with Apex, and have you used any of that for this business?
Yeah. So, I've been doing like the Build Your Machine and also the community commissions recently, building really our group. I started a special needs parents of Florida group, and it's not really just about us. It's about providing those resources and really bringing the people together within that group. But some of the Apex stuff as far as marketing and um, personal branding and that stuff, it's great. you know
Yeah. Have you gotten a lot of business from that, from building your machine and getting your name out there a bit more?
um so I wouldn't say business, but definitely making more connections. I've got we're looking at an opportunity in Pennsylvania right now because someone found me by building my machine. Of
Oh, wow.
becoming that industry expert rather than you know every day trying to you know sell someone on what we do. Just building that awareness for what we do.
Yeah. Yeah. That's amazing. So you're posting content, you've got the group stuff going on. By the way, the purpose of your group, is it for parents with kids with medical issues? Is that like kind of the point of it?
Yeah, a place for them to connect and find resources or find families going through similar situations that might be helpful to guide them throughout their journey. And there's we just hit 1,300 people in the group, which we only started about 6 months ago building it. So I'm happy with that.
Wow.
Yeah,
So you're hitting a nerve. There's a real need in what you're doing.
yeah, yeah, and it's nice to see the parents connect and say, well, my child has this diagnosis, and we were looking at this for help. Does anybody have any recommendations of what could do it? I mean, I've personally also used it. I spoke about my daughter with cerebral palsy. She's just got went through casting and got braces. So I was looking what type of shoes are the best, and where do you get the shoes? And a ton of people say you can get them here, and then just the other day someone tagged me and said Burlington Coat Factory has the shoes for $17, so you might want to go check that out.
Oh, wow. That's
Yeah,
cool. I'm always kind of looking around in my local. I live near the Tampa area because we're like an hour away from each other. We found out,
yeah.
small world, but I'm always kind of trying to find different like community service opportunities. Do you guys ever do anything like that, or do you know of places that are open to like volunteer work, people who just want to get involved and help you guys?
So we've done different things where we've had people that come and volunteer and help, and sometimes they'll read books. We've not done it since COVID. We kind of took took a step back from that. Um, but there's definitely other places that look for people to volunteer. Um, I know more about and it's not locally to us, but in the St. Augustine area, because we've recently, tried to make a push there to bring resources together, because it's not, you know, there's definitely a lot there, but in Tampa area, it seems like everything's a little more well known there. We're trying to bring people together and the resources together so they can help each other. Last year we did a resource expo and had 50 vendors there, and I think we were at like 3 to 400 people that actually came to the event. So it was a good event.
Awesome. Awesome. Well, cool. And yeah, I'd love to hear any of your like your favorite stories, whether it's transformational, testimonial. You talk about you've seen the incredible things that can happen in your facility. I'd love to hear kind of your favorite stories,
Okay.
if you don't mind sharing.
Yeah. So one of my favorite is it started when I was driving part time. My this is 13 years ago. My daughter was just born, and we started a new patient that was just born like my daughter, but know she had the medical complexities that we needed to take care of her, and she was with us until the age of 13, or the age of third grade. And at third grade, we were able to transition her to a regular school and on grade level and ready to go. Um, Another one, and this is, same timeline. This little boy had came to us for quite some time, and then transitioned to the public school. And just last month, we were at a specialist appointment in St. Pete, and we seen him and his mother. And my wife worked with him daily, on the education stuff, just to hear how well he's doing, and then to see him, he was bigger than my wife, and see him grown, and hear like how he's making friends in school and how he's doing all these activities, and what you could see, like we had a small part in form helping to get where he was. It's just amazing. Another one, there was a girl in our Dunellen facility, and with her diagnosis, they said, she'll probably not walk, or not have the ability to walk.
Mm,
Um, Watching her go from, it's kind of like a walker, like a gait, they call it a gait trainer, and watching her go step out of that gate trainer and walk across the room was one of the best things I've ever seen. You know, she
wow.
walked she walked across the whole room, and this is a girl that he said might not ever be able to do that. So when you're watching those things happen, that feeling is irreplaceable.
So I got to unpack that for a minute. I mean, how long did that take from starting to like, was it a surprise or did you guys kind of expect that she was,
No, it
down?
had been something they had been walking or working on in therapies. Consistent work on 3 days a week of these therapies, and not even just with the therapist, but then the nurses as well. Trying to do those interventions and those things throughout the day while she was there. But she was with us. She was with us probably 4 years at that point when then she started to do that.
Wow. How old was she when she made her first step?
Uh, she was 6, I believe.
Wow.
Yeah.
What was that like for her?
Oh, the joy on her face was unbelievable. She was so proud of herself, and to see how proud she was of herself for doing that was
I
amazing.
bet. I bet. I can't imagine that. That's incredible. And was there like family in her life?
So the family wasn't there, because we're like a daytime facility. Typically, we pick them up and drop them off at the end of the day. Um, but to hear them when we try to, I think we have that on one of our videos of her walking. We try to get, when we know something like that's going to happen, we try to capture the moment, and we'll send it to the parents, and then with their blessing, putting on our social media.
What was the family's reaction when they learned that she had taken
Uh,
her
they,
first step?
They knew that it was coming, because it was getting closer and closer. But um, you know, they were mom particularly was overjoyed and just um, thankful. And the child no longer qualifies for a service. She graduated, so you know still be able to touch base with the families afterwards and know the impact we had. It's amazing.
That's incredible. So, helping kids take their first steps, getting them transition into public schooling wouldn't necessarily have happened if they weren't in your care, right?
Yeah, I mean, I'd like to think that eventually it would happen, but I think we play a major role in the ability for that to happen. Especially if they were at home without getting these services, or if they were at home with just a nurse, they're not getting all encompassed services. They're not getting everything as far as the therapy is, the education, and the ability, to socialize and then see other children do it and try to go after those things.
Yeah. So it's possible it could have happened eventually, but very likely it wouldn't have if it weren't for you
Yeah,
guys and the help that you provided.
yeah, yeah. It's
That's amazing.
you know, it's like I said, that what we do and how we can make a difference. I tell everybody because I really truly believe in the difference we make for families.
Yeah. Well, and chatted with you about that, and that's why I'm like, I gotta have you on to talk about this because I want to share and help with that as much as I can. Uh, Talked about a good bit there, and I feel like we're ending on a high note. But is there anything else you feel like you'd want to share that maybe we haven't touched on yet?
Um, if you want to see some of our videos, check out our social media pages. Tender Care PPAC. We're on every platform, and been a little lacking on some of the content lately. But if you go back and look at some of our older content, you'll see a lot of these moments. You'll see the kids with the communication devices learning how to, express their feelings with them. You'll see children taking steps. You'll see a lot of the different things we talked about.
I'm gonna go check those out. I'm gonna recommend anyone you can go look at them, like, share the content. That's how the stuff gets spread. That's how more families get helped. So
And
happy to do
thank
that.
you.
It was a pleasure talking to you, Thomas, and wish you all the best.
I appreciate it. Thank you.